Blessed day to each and everyone. My research title is all about pandemic preparedness of healthcare team and healthcare facilities in La Union. For the introduction, according to Gupta and Federman 2020, in the last several decades, pandemic preparedness has not been this urgently and widely needed. Moreover, the pandemic response has never been so urgently required worldwide, nor this well informed. Amo Iñarco 2016 states that healthcare professionals' preparedness for emergencies is quite indispensable in quality healthcare. According to PremierSafetyInstitute.org, staff and healthcare facilities play an essential role in emergency preparedness and response efforts for all types of incidents such as natural or man-made disasters, pandemic outbreaks, and terrorist attacks. During emergency or disaster, healthcare services must be readily available to meet the demand surge. According to covid19.gov.ph, the coronavirus disease 2019, or known as the COVID-19, discovered in Wuhan, China in 2019, is a new strain of the virus and an infectious disease caused by severe acute respiratory syndrome. This research aimed to present a program that will prepare the healthcare team and healthcare facility before an emergency or disaster arises. This descriptive developmental study aimed to determine the level of planning and implementation of the programs and activities prepared for the healthcare team and healthcare facilities in the province of La Union and its relation to some factors as basis in the formulation of a healthcare preparedness program for the healthcare team and healthcare facility. For the theoretical framework, number one is Patricia Benner's theory of from novice to expert. It states here, nursing skills are an experience and a prerequisite for becoming an expert, in which expert nurses develop their skills and knowledge of patient care over time through a combination of a solid educational foundation, a multitude of personal experiences from real situations, and learning through experiences. The second theory is the systems theory. It states here, a system is a collection of elements or components that work together to achieve a common goal. Each part of the system has its role in the delivery of effective quality healthcare. They work together and support each other for the betterment of the healthcare delivery system. And last is the transformational leadership theory. It states here, it focuses on how leaders can help their followers make significant and positive changes. It focuses on transforming others to support each other and the organization as a whole. Healthcare systems are made of numerous professional groups, teams, and specialties that work in complex nonlinear ways. Leadership must take advantage of its diversity and effectively maximize resources while inspiring employees to work towards common goals. For the statement of the problem, number one is, what is the profile of the respondents based on age, position, educational attainment, length of service, recent trainings on healthcare delivery during crisis or emergency? Two, what is the level of preparedness of the healthcare team during pandemic along knowledge, skills, attitude, and working relations? Three, what is the level of preparedness of the healthcare facilities during pandemic along physical facilities, resources, and systems? Four, is there a significant relationship between the respondent's profile and the level of preparedness of the healthcare team? The respondent's profile and the level of preparedness of healthcare facility and the level of preparedness of healthcare team and the level of preparedness of the healthcare facility. For the method, descriptive developmental design was used. The study is descriptive since it describes the status and the level of preparedness of the healthcare team members and at the same time, the level of readiness of the healthcare facility as it naturally occurs. It is developmental since it uses the data on the level of preparedness of the healthcare team and healthcare facility as a basis for the formulation of a healthcare preparedness program intended for healthcare workers and healthcare facilities to readily, efficiently, and effectively respond during pandemics. For the participants of the study, the healthcare workers for COVID-19 comprising of doctors, nurses, medical technologists, midwives, pharmacists, institution workers, drivers, and maintenance staff from the 14 healthcare facilities in the province of La Union. Purposive sampling method was used with the following inclusion criteria. Number one is a healthcare worker for COVID-19 currently working in the selected healthcare facilities, either male or female of any job status, and at least with a 1-year length of service. For the data gathering tool and procedure, it is a researcher-made questionnaire which was subjected to validity tests by 5 experts on health emergency and disaster preparedness. The reliability testing was conducted in La Union Medical Center and Manaoag, Pangasinan. For the data management, frequency counts and percentages to compute the profile of the respondents. Weighted means to determine the level of preparedness of healthcare team and healthcare facility, and the Pearson's product of moment of correlation to calculate the significant relationship between the respondent's profile and the level of preparedness of the healthcare team. The significant relationship between the respondent's profile and the level of preparedness of healthcare facility, and the significant relationship on the level of preparedness of healthcare team and the level of readiness of the healthcare facility. For the results and discussion on the profile of the respondents according to age, the result shows that 58 or 24.68% are aged 31 to 35 years old, while 3 or 1.28% are 61 to 65 years old. This shows that most of the respondents, 61.28%, ages 26 to 40, are the more matured, better experienced, and more active healthcare workers. For the position, 82 or 34.89% are nurses, while 12 or 5.11% are pharmacists. The result shows that most healthcare team staff are nurses who provide direct patient care. Nurses play multiple roles and quickly adapt and perform some healthcare procedures with enough training and experience. For the highest educational attainment, 175 or 74.47% are college graduate, while 3 or 1.28% are high school level. The result shows that higher educational attainment is essential for professional preparedness, especially in technical areas. In contrast, those who belong to non-technical areas don't need to be at least a college graduate. For the length of service, 111 or 47.23% are 5 years below in service, while 4 or 1.70% are 21 to 25 years in service. This shows that most of the staff are new and beginners in service, in which they are still fresh from school and have not enough training yet when it comes to disaster and emergency preparedness. With this situation, there is a higher chance that they can make an error in performing nursing procedures and at risk of different types of injuries, supported by a study stating that the younger and who served for shorter periods were more at risk for various kinds of injuries. For the number of recent training, 164 or 69.79% has 1 to 3 recent training, while 4 or 1.70% have responded each for 7 to 10 training and 11 and above. A study states that training is essential to employees to improve their productivity and performance. Besides, it provides them with the knowledge and skills they need to fulfill their duties and positively affect the business. For the healthcare team's preparedness level during a pandemic, in the areas of knowledge, skills, attitude, and working relations, it has an overall mean of 2.71, which means very adequate, shows that the healthcare team is very adequately equipped and prepared along the 4 areas. The attitude of the healthcare team garnered the highest weighted mean of 2.77 in all areas. Working relations 2.73, skills 2.67, and knowledge follow. It shows that attitude goes with working relation and knowledge with skills, signifying that he can efficiently work and collaborate with his team when one possesses a good attitude. Also, when one knows about the nature of the task, he already has the idea of what he should and should not do, then his skills eventually come out with the confidence to perform it. For the healthcare facilities preparedness level during a pandemic, in the areas of physical facilities, resources, and systems, it has an overall mean of 2.39, which means very adequate, shows that the healthcare facilities are very sufficient, prepared, and have more than enough physical facilities, which are the structures, resources, the equipment and supplies, and systems for the coordination and referral are in place. Healthcare facilities must provide care for all patients in the best and safest way possible for patients and healthcare staff. Being ready and always prepared for any predictable or unexpected events in our lives enhances self-discipline and strategic thinking. Preparation is the key to the success of an engagement. For the relationship of respondents' profile and the level of preparedness of healthcare team and the healthcare facility, the respondents' profile and the level of preparedness of healthcare team shows that position, highest educational attainment, and the number of recent training are interpreted to be significant, but the variable position and highest educational attainment are interpreted to be significant in all areas. Therefore, position and highest educational attainment has a significant relationship to the level of preparedness of the healthcare team. On the other hand, the profile of the respondents has no significant relationship to the level of preparedness of the healthcare facility in the 3 identified variables. Earning a degree is empowering in the sense that it enhances one's morale and gives them a sense of accomplishment, allowing them to be well prepared and equipped to master challenging tasks and resolve adversity, resulting in improved satisfaction and reduced stress. For the relationship of level of preparedness of the healthcare team and the level of preparedness of the healthcare facilities, the result shows that the healthcare team's level of preparedness is significantly related to the preparedness of healthcare facilities. These two variables go together, and it only signifies that if both are adequate in all areas, then the healthcare team and healthcare facilities are well prepared and equipped during this pandemic. A healthcare worker with enough knowledge and skills and enough experience and confidence while doing their job with a healthcare facility with enough resources is well prepared and equipped. Teamwork and collaboration and always ready and prepared anytime are essential to developing health promotion, preventing life loss, and delivering the best and quality care to the people. That will be all. Thank you.